The National Health Insurance Fund has long been the subject of controversy, with challenges such as inadequate funding and embezzlement of funds hampering the provision of universal health coverage.
There may have been an oversight there.
Ahead of the UHC launch at Mashujaa Day celebrations in Kericho on Friday, President William Ruto has assented to 4 health bills which are expected to reform the ailing health sector. The laws include the Digital Health Act, the Primary Healthcare Act, the Facilities Improvement Financing Act, and the Social Health Insurance Act. Under the Social Health Insurance Act, every Kenyan will be required to register and contribute to the Social Health Insurance Fund. Those who have no proof of registration will not receive government services.
What happens to the person who cannot afford 300? I want to say, under the laws we have passed, even those who cannot afford 300 will now have an opportunity to have an insurance cover.
Salaried Kenyans will have to dig deeper into their pockets to contribute 2.75% of their monthly pay, while those with alternative sources of income will contribute based on their ability as determined by a means testing instrument. The fund will deduct a minimum of 300 shillings and a maximum of 5,000 shillings. This is a marked departure from the NHIF model, which deducted a minimum of 150 shillings and a maximum of 1,700 shillings and charged premiums based on a graduated salary scale. Those who default on their contributions will pay a fine of 10% of the contribution and be denied health services until they pay their arrears. The law also establishes a primary healthcare fund, which will provide payments to health centers, and a fund for emergency and chronic diseases, which will enable those who have depleted their social health insurance to receive care.
We have seen situations where there is an accident or there is an emergency, somebody goes to hospital, and they are turned away from hospital because they don't have a health card, they don't have somebody to sign for them. This will be a thing of the past.
Under the Primary Healthcare Act, one community health officer will serve 100 households and refer those who need medical care to primary health facilities. Primary health networks will also be established in every sub-county. Under the Digital Health Act, the government will establish a comprehensive integrated management information system for patients' data and provide digital health services.
We have worked very well with support from my colleague, CSO Wallo, who has ensured that infrastructure has been laid in facilities, and we are now on the second layer of ensuring that we operationalize those facilities, Your Excellency.
The Facilities Improvement Funding Act will also strengthen the management of health facilities by ensuring revenue is pumped back into them and is not diverted. The 4 acts have received criticism from civil society, who have termed the increased contributions as a burden on Kenyans. According to health union leaders, the government must recruit more health workers to ensure the reforms bear fruit.
We want a very clear line that says the majority of the funds should be to the public, because we've had a scenario where a National Hospital Insurance Fund, 80% of it goes to the private sector. So and also we are really advocating that the Social Health Insurance Fund should not be, they should not outsource a private insurance company to manage the fund.
These reforms are expected to transform Kenya's health sector, which currently denies coverage to millions of Kenyans, and improve access to health services. Muriel Adhiambo, K24 TV, at State House, Nairobi.